Okay, let's talk today about one of the most common skin conditions that affect 10% that affects 10% of the world's population. What I'm talking about is acne, more properly known medically as acne vulgaris. Uh, as I said, it affects many people around the world. Basically, acne is an inflammatory condition of the skin. It's caused by a type of specific cause of acne is a type of bacteria called P. acnes. P. acnes is activated during, you see a lot of teenagers or adolescents, they very often break out in acne. The reason for that is when you enter adolescence, you get a surge of the adrenal steroid hormone dehydroepiandrosterone, or DHEA. DHEA stimulates the secretion of sebum, which is a type of oil that's secreted in the hair follicles to basically keep the hair follicles, let's say, moisturized, hydrated, or whatever. And what happens is the P. acnes, they love sebum. It's like food to them. And the DHEA overstimulates the production of sebum. The P. acnes that are on the skin all the time, they start to basically consume the sebum, but unfortunately, this causes a inflammatory condition of the skin. Now, any type of androgen besides DHEA, I should also want to mention while I'm the subject of DHEA, is that DHEA always increases testosterone in women, not men, but in women. It has to do with the pathway of androgen synthesis. But the point being that when women take, let's say, supplemental DHEA, they always get an increase in androgen. Now, the problem with that is 50% of women who use DHEA for whatever reason, a lot of them take it because they want to increase testosterone, whatever. The 50% of women who use DHEA supplements do get acne, even if they've never had acne in their lives. So if a woman is contemplating taking a DHA supplement, I would suggest that she start out with a very small dosage, something like 12 milligrams, 10 to 12 milligrams a day, and see how her skin reacts. Now, besides androgens, and of course anabolic steroids are androgens, and they are well known to cause acne. In fact, one of the defining characteristics of high-dose anabolic steroid usage is acne. And they get acne. You get it can be on the upper arms. You get acne, of course, on the face. That's what teenagers and women usually get it. But you can also get acne on the upper arms, the trunk, and the back. For some reason, a lot of bodybuilders who've used high-dose steroid regimes, they get very severe acne on their back. In fact, it can develop into something called cystic acne, which is open lesions that can leave scars. It has to be usually be treated by isotretinoin, a certain drug. But a lot of these, I remember going to a contest years ago. There was a woman sitting next to me, just an acquaintance, and she noticed that when the bodybuilders turned to the back to show their backs, a lot of them had these severe acne lesions. And she asked me, is that normal? Is that from working out? So I had to tell her, no, that basically means they're probably using high-dose steroids. But besides steroids, there's a couple of other things that can cause acne, including certain medications, lithium, which is used to treat bipolar mental disorders. Anticonvulsant drugs can cause acne. Even exposure to excess sunlight causes acne in some people. Wearing occlusive wear like shoulder pads, headbands, backpacks, they can cause acne. A condition in women called polycystic ovarian syndrome, which is characterized by an increased production of androgens, because testosterone in women is partly produced in the ovaries. When you have these multiple cysts in the ovaries, they produce excess testosterone, which can stimulate acne. Some women who are pregnant break out in acne when they've never had in their lives. And there's genetic factors that have to do with the percentage of fatty acids that are in the sebum secreted in the skin. The inherited ability to contract acne ranges from 50 to 90%. Acne in most people, first, as I said, appears in adolescence and usually lasts all the way into the 30s. It's more common in men than women. About 20% of individuals who develop acne develop the severe acne, which I mentioned earlier, the cystic acne, and that can result in permanent scarring. Asians and Africans tend to develop severe acne, but mild acne is more common in Caucasian or white people. People with darkest skin tend to develop hyperpigmentation. As I said, the sebum secretion is increased as 5-alpha reductase. Actually, what happens is there's a enzyme in the skin called 5-alpha reductase, and it functions to convert testosterone into DHT. It's also found in the scalp. The DHT in the scalp causes male pattern baldness. In the skin, 5-alpha reductase converts testosterone to DHT, which the DHT then binds to receptors on the sebaceous glands, which secretes sebum and increases sebum production. And that leads to an increased hyperproliferation of what they call the follicular epidermis, so the retention of sebum, basically the sebum kind of plugs up the pores of the skin, and then the follicles rupture and release pro-inflammatory chemicals which stimulate inflammation, and there's your acne basically. So acne is you could say is a inflammatory skin disease. Factors that can cause acne or make it worse include foods with a high glycemic number, like dairy products. I'll get to that more in a minute. Junk food, chocolates. Now, for years, medical texts often said that food does not affect acne. This was in many medical texts and articles about acne for many years. They thought acne was primarily a hormonal disorder, again related to overstimulation of the sebaceous glands in the skin by androgens such as DHEA and DHT from testosterone. But over the years, they become to realize that foods definitely do influence the course of acne, especially if you're one of those people, as I said earlier, the people that have a genetic tendency to get acne. If you eat these foods, it can very often stimulate acne. Certain oil-based cosmetics can also plug up the sebaceous glands and cause acne. Some women who in the premenstrual phase of their menstrual cycle, they get like an edema of the xylosebaceous tract that's caused, and that happens in 70% of female patients will develop acne in the premenstrual period. You can even get acne from severe anxiety and acne, and that's probably because it stimulates the increased production of some of these hormones. So let's see, there's different grades of acne. I'm not going to get into that stuff. As far as the treatment goes, as I said, topical retinoids like retinoic acid, tretinoin, are used alone, or there's one called benzoyl peroxide, which is a liquid you could put on your skin. That treats basic acne very well. Retinoic acid is the best way to kind of thin out that sebum, and it comes in different strengths. Retin A is also very good to stimulate, even if you don't have acne. If you use a topical form of Retin A, you put it on your skin. Dermatologists or skin specialists will tell you that with all these anti-aging skin creams, most of them are bullshit. They don't do anything. They're very expensive. They don't do anything to stop wrinkles and lines. The one thing that actually does work is Retin A. If you put a low strength Retin A on your skin, something like 1%, something like that, or 2%, it actually causes a little bit of inflammation, not to the point of causing acne, but it actually stimulates the production of increased collagen and elastin. Those are the two skin supporting proteins, and it can actually help reduce the appearance of wrinkles and lines in your face. Another way to treat acne is with certain antibiotics, clindamycin 1 to 2%, erythromycin 1% gel. Some doctors will give estrogen hopefully only to women, because estrogen blocks the effect of androgens in causing acne. So estrogen is anti-acne, unlike testosterone. I think that benzoyl peroxide, in my experience, I've never had acne, but I've seen people have acne. And with a mild case of acne, I believe benzoyl peroxide is an over-the-counter medication. Topical, like I say, it's a liquid. You put on your skin, and in about 90% of cases, it'll help really get rid of basic acne that hasn't progressed to the more severe cystic form, which would require stronger medication like tretinoin. As I said, there's various antibiotics. But what I want to also talk about here, I mentioned earlier that some foods are associated with acne. So I'm going to talk about a couple of foods that can actually promote acne. Refined grains and sugars. People with acne, studies have shown, tend to increase. People with acne tend to eat more refined carbohydrates than people with little or no acne. Refined carbohydrates include bread, crackers, cereals made with white flour pasta, white rice and rice noodles, sweeteners like cane sugar, maple syrup, and honey. One study found that the frequent consumption of foods high in sugar or fat was associated with a 54% higher odds of having acne, while eating sugary beverages increased the risk of acne by 18%. Now, the increased risk is caused by the effects of refined carbohydrates on blood glucose levels and insulin levels. Insulin, what insulin does basically helps to metabolize sugar and or glucose and get it into cells. But insulin also, higher levels of insulin are associated with increased acne occurrence. Dairy products. Some people who drink milk, especially sweet, and when you're a teenager, they develop acne. What is it in milk? Some researchers think that the dairy products can increase insulin levels, which again, higher insulin levels are associated with acne. Some people say that the milk contains insulin-like growth factor 1, which has been linked to the development of acne. I have some doubts about that, because insulin-like growth factor 1 is a polypeptide hormone, meaning it's composed of large chains of amino acids. I think orally ingesting IGF-1 would be largely degraded in the liver. Very little would get out into the systemic circulation. So even though some researchers claim that the IGF-1 found in milk can cause acne, I don't buy that at all. It doesn't make sense from a biochemical point of view. Of course, fast food, junk food, like junk food, burgers, McDonald's, nuggets, KFC, French fries, all that kind of crap, that is known to increase acne. A 2010 study of 5,000 Chinese teenagers found that high-fat diets were associated with a 43% increased risk of developing acne. Eating fried food alone increases the risk of acne by 17%. A study of 2,300 men in Turkey found that frequently eating burgers or sausages increased the risk of acne by 24%. But why fast food is associated with acne probably has to do with altering either gene expression, activating genes that are known to be related to acne causation, or altering hormone levels such as androgens, possibly increasing androgens, which are again known to stimulate acne. Now, one food that has long been suspected of causing acne is chocolate. It's been a suspected trigger of acne since way back in the 1920s, but nobody really, it's kind of up in the air with chocolate. One study did find that acne-prone males who consume 25 grams of 99% dark chocolate each day showed an increase of acne lesions after just 2 weeks. A 2014 study found that males who were given capsules of 100% cocoa powder each day had significantly more acne lesions after 1 week compared to those who took a placebo. Why chocolate would increase acne is unknown, but one study found that eating chocolate prompted skin peeling in the outermost layer of the skin, or the epidermis, and an increased bacterial colonization, and that would contribute to acne. But it's still, again, unclear just how strong. A surprising cause of acne in relation to food and nutrition is whey protein. Now, I've actually seen about 5 studies where people who used whey protein developed acne. In all of these studies, the people that developed acne from whey were teenagers. What is in a whey protein that can cause acne? Some older research implicated certain amino acids, leucine, which is a branched chain amino acid, glutamine. These make the skin cells grow quicker and divide faster, which can contribute to the formation of acne. Another possibility is the amino acids in whey can stimulate the increased production of IGF-1, which can cause acne if the one in the body, not found in food. So that's another possibility. As I said, there's been a couple of studies that showed a connection between whey and acne, and again, when I've read these studies, I've seen about 5 of them. They almost always involve teenagers who, as I said earlier, tend to get acne anyway because they have increased production of DHEA. DHEA is an androgen. As I said, it starts to peak when you're a teenager, when you first enter adolescence, and that's a known cause of stimulating excess sebum, and that will cause the P. acnes bacteria will act on the sebum and cause acne. So, the fact that these 5 studies showed that the cases of acne which showed up in people drinking whey were all teenagers makes me suspect that it wasn't the whey protein, but it was actually the normal production of DHEA, and it was blamed on the whey protein. Speaking personally, I've used whey for at least 30 years. Various brands of whey, various types of whey concentrate, whey isolate, hydrolyzed whey. I've tried every type of whey. I've never gotten a single acne lesion from it. Never. Of course, I didn't get acne as a teenager. I was one of the lucky ones. I never had acne. So I don't know anyone personally who used whey protein supplements who got acne. Although, as I said, I guess it's a possibility. I've never seen or met a single person who's had acne. If you're sensitive to certain foods, it can cause hypersensitivity reactions, which could stimulate pro-inflammatory chemicals such as inflammatory cytokines, which are immune system proteins, which might promote acne. So you've got to be careful. The type of foods you want to eat is, for example, omega-3 fatty acids, as found in fatty fish, is anti-inflammatory. And some studies have shown a connection between higher intakes of omega-3 fatty acids and decreased acne. Probiotics promote a healthy gut and intestinal microbiome, which is, again, related to reduced systemic inflammation and a lower risk for acne. Green tea also reduces inflammation and it might help to reduce acne. Some studies have shown when green tea is applied topically to the skin, it helps to reduce acne lesions. Turmeric is anti-inflammatory. Paleolithic diets, which focus on lean meat, fruits, and vegetables, and are low in grains, nuts, and legumes, they've been associated with lower insulin levels, which would benefit acne. Mediterranean diet, which is the best overall diet, which is focused on fruits, vegetables, whole grains, beans, fish, and olive oil. Low in dairy and saturated fat, also been related to reduced acne development. So that's about it. I will point out, as I mentioned earlier, just to emphasize, those who use anabolic steroid drugs have a much greater chance of developing acne. And not only that, but if they keep taking them, they will probably progress to the cystic acne form, which again is those open, ugly pustules that you see on the skin. That will lead to scarring unless they take that tretinoin drug pretty fast to try and thin out the sebum, and hopefully the lesion will clear up. But if they don't treat it rapidly enough, they'll get permanent scars from acne. Whether you might wonder, do oral steroids and injected steroids differ? No, it makes no difference whether the steroids are oral or injected. They both stimulate the DHT production, and and even if they don't, they stimulate excess sebum secretion, which always lays the groundwork for acne. So why doesn't everyone who uses steroids develop acne? Again, there's a genetic component. Not everyone somebody could take a boatload of steroids. A lot of bodybuilders have, and they will not get acne because they don't have the genetic, let's say, heritability to develop acne. So just the same reason why some bodybuilders can take huge amounts of steroids or testosterone, which are known, the byproduct of testosterone, dihydrotestosterone, DHT, is the known cause of male pattern baldness, and yet many bodybuilders use massive amounts of steroids and never go bald, while others do. Again, for the same reason. They don't have the genetics for male pattern baldness, so again, no matter how many steroids they take, they won't go bald. Others, I've seen bodybuilders years ago who were in their 20s who took large amounts of steroids. Let's say they started when they were 22. By the time they were 24, they were completely bald. And back then, when I'm talking, the 70s, baldness was not in. It's not like today, where every other guy on the street is completely bald. Back then, it was really a stigma to lose your hair. Many men were very self-conscious about it, and it was a bad thing. In fact, as I've said in previous videos, this is kind of humorous, but one of the main reasons I dropped out of physique competition was because I had progressed to the point where I either had to take steroids to continue to compete on a even plane with the other competitors, or drop out. I couldn't compete without using steroids. I didn't have the greatest natural genetics, and even if I did, I still couldn't compete against the steroid users. But the thing the main reason why I didn't want to use steroids is there was the health aspect, where I didn't know a lot about steroids back then. I didn't know the full health effects, but what I did know from observing other young bodybuilders my age who did use steroids was that at least half of them lost their hair. And that was a horrible thought to me, because both my grandfathers were bald by the time they were 30 years old, and I knew that I probably had genetics for male pattern baldness. So I had to make the decision: is it worth it to go bald and possibly, compete successfully? Back then, the answer was no. Would I use steroids today? Debatable. I'm not sure, because today the current steroid regimes are so crazy that I don't think I'd use them. Back then they were much milder steroid regimes. They weren't even that dangerous. Again, the biggest problem with the steroids regimes back then was if you had the genes for male pattern baldness, you'd go bald. But today, with the plethora of drugs, and really dangerous drugs that weren't around back then, like trenbolone, and these other steroids that are used in massive amounts, I still wouldn't use steroids. I would not compete. I would continue to do just what I do today, which is train. I train for health and to try and maintain as much muscle as I can. Okay, that's enough of my personal philosophy. If you want more information about nutrition, exercise science, anti-aging research, ergogenic aids, hormonal therapy, supplement science, which ones work, which ones don't, effective fat loss techniques, women's health and fitness, all of this is covered in my Applied Metabolics publication, www.appliedmetabolics.com. There's a lot of digital publications out now that are related to health. Some focus on nutrition, some focus on strength training or just resistance training, but there's none that I have seen that basically can match the variety of topics that I cover in Applied Metabolics. And furthermore, there's none that can match my experience in this business, which is 62 years of constant study and practical experience of being in the gym itself. Nobody, as to my knowledge, who publishes a digital publication can match that. Also, None of these people are professional writers, which I am. I have over 50 years of experience as a professional writer. I was an editor for several major bodybuilding magazines, and I know how to write for the public. Applied Metabolics is written in a magazine style. That means it's very few technical terms. Any technical terms that are in the articles are readily explained by me, so you don't have to reach for a medical dictionary. The other digital publications, fortunately, they're written by a lot of grad students, who have degrees, advanced degrees, and they still haven't gotten away from writing in a dissertation style, meaning they're heavy on passive writing, using a lot of technical terms. Some of them are basically, all they do is write about new studies, which to me is not very interesting. Yeah, they simplify it for the public, that's true, but the studies they write about have very low practical value. And that's one of the keys to applied metabolics. I call it applied because it's of practical value. It contains information you could use today, not some stuff that's interesting but has no real practical value like these other publications. And the best thing of all, Applied Metabolics is probably the least expensive digital publication you'll find. It's about 1/3 the price of most of the other digital publications, and yet it has about 8 to 10 times more information each issue. Comes out on the first of the month. There's no ads. If you don't subscribe to Applied Metabolics, you're making a big mistake, because I can save you a lot of headaches and save you a lot of money from not buying crappy fake supplements and doing stupid routines that'll do nothing but hold you back. I tell you the 100% truth. I promise that. I guarantee it. It's in Applied Metabolics. So subscribe today, www.appliedmetabolics.com. When you subscribe, send me an email. I'll send you an invitation to join my private Applied Metabolic Facebook page, where each day I post new information on nutrition, exercise science, and general health and medicine. I have an email portal on my Applied Metabolics webpage where current subscribers only can send me short questions about anything they read in Applied Metabolics or anything else that comes to mind pertaining to nutrition and exercise science. And I will be happy to answer those emails as a service or appreciation of your subscription, which naturally follows that this only applies to current subscribers. I will not answer, unsolicited questions. However, you're welcome to leave comments underneath these videos, particularly suggestions for future videos. If I feel that the topic that you're requesting will interest a large number of people, I will try to do a video on it. And the one thing you could be assured of with my videos, just as you can be assured with my Applied Metabolics publication, is that you're going to get the 100% truth. There's no BS. There's no crap. I'm not going to try and sell you some shit product, or I'm not going to try and veer you. I'm not some shill that's going to try and veer you to some site that's selling very expensive anti-aging supplements that cost a fortune. I'm not going to do that. I'm only going to give you the truth. I'm one of the last bastions of truth on the internet, if I say so myself. So please subscribe today to this channel. If you're not already a subscriber, let others know about it. And by all means, if you really want to learn, if you really want to be informed about exercise, nutrition, and bodybuilding, general health, and disease prevention, subscribe to Applied Metabolics, www.appliedmetabolics.com. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. As I said in a past video, my little dog Bruno passed away on March 12th. He'd been in declining health for a while. He had basically died of a kidney failure. I miss him terribly, to tell you the truth. I had that dog for 20 years. He was 23 years old, and rest assured, I will get another dog. Most of the dogs I've had have come to me through various circumstances. I've never actually gone and picked up a dog at a kill shelter, although I'm certainly willing to do that. And if I don't get a dog very soon through this serendipity effect, I will go to a local shelter and save a dog, because I think that's a very meretricious thing to do. You're saving a life. And it's a great thing, and believe me, the dogs are appreciative. They will love you from the time you get them to the time they pass. They will be your best friends. They will be loyal to you, and they will never turn their back on you. That's what I love about dogs. They're the best. Thank you for listening. Take care.